So tell me a little bit about these images from South Africa.
Most of the pictures from South Africa were taken in the Queen of Scotland Hospital in Tugela Ferry in KwaZulu-Natal. It's a very rural place, very poor, and they had a high incidence of HIV/AIDS in that district, and they had a major outbreak of XDR-TB, extremely drug-resistant TB, that was fatal for most of the people who caught it. I had been in that hospital in the year 2000 when I initially did a story for Time on AIDS in Africa. So I knew the director of the hospital, Dr. Tony Mo, and naturally when I wanted to do a story on TB, I wanted to go back there because it was so in the forefront of the XDR-TB, the emergence of XDR-TB. In Swaziland, there's a group of missionaries called the Kabrini Sisters in a very rural part of Swaziland who go out and make house calls on people in the countryside to deliver medication, make sure they're taking their medication, they deliver nutrition. There's a group in Cambodia called the Cambodian Health Committee that does the same thing. They go out into rural areas, the poor rice farming districts where transportation is a problem and communication is a problem, and they actually deliver the medication and monitor it. And it's also associated with clinical studies. So the Cambodian Health Committee is not only working on the care level, they're working on the research level. So they combine a couple very important aspects of TB treatment. India has the highest infection population of TB. Of course, it's a huge country, and because it's still in many ways a developing country, it has conditions in which TB, breeds quite readily. It has densely populated slum areas, and because TB is an airborne disease, its contagion happens more readily in those kind of overcrowded conditions. So there's a lot of TB in India. But India is also a place where there's a degree of professionalism in how it's cared for. I mean, it's definitely not perfect, but they do have huge TB hospitals, and they do, direct a lot of focus on TB, especially. And they've been in the forefront of some of the major developments in treating TB, such as DOTS, which is directly observed treatment. So India is a very important place when you're talking about tuberculosis. The most amazing facility that I saw was in Lesotho. It was a place that was a clinic that was a partnership between the national program and Partners in Health, which is an American-based NGO. And just the way they set up, the way Partners in Health set up the facility was really impressive. It was just on every level, from the atmospheric control, ventilation, and negative pressure to cut down the possibility of airborne infection. The way they were training local staff, nurses and doctors. It was just a high degree of professionalism in a really a relatively small place, but they did it in the most thorough and professional way that I saw anywhere I went. I was very impressed with them. They also had a program in a prison colony in Siberia, and also, again, very well administered and very professional level of care.